after death, but first we have to talk about the death, right? And so this is my son Darren, and when he was 10 years old, he was diagnosed with acute lymphoblastic leukemia, and he went through treatment, actually perfectly quite well. 2 years later, at the age of 12, he was diagnosed with another cancer called Langerhans cell sarcoma. And this made him the only person in the entire world to have the two cancers together. And so the only thing they could offer us really as a form of treatment was a bone marrow transplant. Now, Darren had chemotherapy, radiotherapy. This was total body irradiation where we had to lay like this. And these markers actually measured the amount of radiation that was going into his body. So he went through another 6 months of intensive radiotherapy and chemotherapy. He had to have mask fixed because the second cancer developed in his tonsils, so they decided they were going to irradiate that area as well. Darren, on the 1st of March 2013, had his first bone marrow transplant. And unfortunately, they didn't go very well. He actually had 4 transplants. Each one subsequently failed for various reasons. It was usually the pharmaceutical medications that were causing each transplant to fail. Now, on the 4th and final transplant, they told us nobody had ever engrafted with a transplant after 50 days, and they told us that this was his 4th and final chance. There was nothing else. They had nothing else to give him. Now, unfortunately, 3 days after he had his final transplant, he trapped his fingers down the side of the beds, and he picked up two catastrophic infections in his hand and one in his mouth. These pictures are not very pleasant, so anybody that doesn't have a good stomach, maybe look away. But the one in his mouth was called Klebsiella, and it started to eat away at his tongue. And the two in his hand made his hands necrotic. And as you can see, this was obviously incredibly painful for Darren, very, very, very painful. Now I asked for, this is when I asked for Bedrocan, because he was on morphine, he was on fentanyl. I'll turn it off now. He was on morphine, he was on fentanyl, he was in an incredibly bad way, and there was nothing more that they could really do for him. So I started looking into natural alternatives to pain relief, to fentanyl, because there was nothing else that they could do. And I found Bedrocan, and I asked the doctor if I could go to Amsterdam and I could pick up Bedrocan and I could bring it back for him. And I was told no, it wasn't licensed for children. The fact that chemotherapy in this country is not licensed for children either, but that doesn't stop them. Darren was in an incredibly bad way, and this was now 46 days after his final transplant, and they told us there was still nothing in there. And so they said to us, you have to move to a hospice. There's nothing more we can do, this is it. Like I said, if nobody's engrafted after 50 days, it's not going to happen. So day 46, we moved to the hospice. And I said to the hospital, you know, when I take him off what I would consider this was, I called it conscious life support, because he was aware and he was awake and he was able to make these decisions with me. And so I said to them, how many days are we talking when you unplug him from the antibiotics that you're telling me is the only thing keeping him alive? How many days do we have left? And they said 3, a week at most. Now, going back to his hand ever so slightly, because of the pain, obviously I wasn't allowed to get Bedrocan for him. He was on fentanyl, he was on morphine, he couldn't have any more pain relief. So they wanted to amputate his hand. And I'd said to them, please don't amputate his hand. And actually Darren had said, you're not taking my, you know, they wanted to amputate down here. And he said, you're not leaving me like a lobster. That's not happening. You want to take my hand, take the whole thing. And I said, whoa, hang on a second, look, the boy's dying. I just want him to die with no pain, right? So can we just sever the nerves? So they did what's called a neurectomy. And they told me that nobody, when you have a neurectomy, that's it. He'll never feel his hand again, he'll never move his hand again. It didn't matter, we just didn't want him to feel what was going on. Obviously, we've all seen the pictures now. So at day 46, which was 11 days after Darren's 14th birthday, we moved to a hospice. And in that hospice we had an amazing time actually, it was beautiful. And 3 days later we had Christmas on December the 14th, and then we had another Christmas. And Darren just was hanging around, but his organs were starting to shut down, everything was starting to fail. And on day 69, I asked them for another bone marrow aspirate. And I said, look, there's a reason why he's still here. Now, you're telling me he's got no bone marrow, but surely there's something in there, he's still alive. So they took him into hospital. So that was his, see, I'm messing up now with the slides. This was his 14th birthday. We signed the do not resuscitate forms, everything. We planned to go to everything. You know, no more physical help was going to be given to him at all. They were giving nothing. This was palliative care. So this was Christmas. And then on day 69, I asked them to do another bone marrow aspirate. So they took him into hospital. This was day 69. And they did a bone marrow aspirate and came back to me and said, I'm really sorry, there's nothing there. There's nothing there. This is just the case, you're going to have to wait and see, something will get him. And so Darren started to get very anxious. They were upping the morphine, they were upping the sleeping tablets, they were trying to keep him comatose really because of the anxiety he was feeling. He was facing his impending death and they couldn't do anything to kind of help speed that along. Now Darren had made a death plan. It's something we all have to do when we sign the do not resuscitate forms. They talk to if the child is old enough, they talk to the child and the child will decide how they want to die. Now Darren said he didn't want to die on morphine because they'd taken everything else from him, they weren't going to take his death. He wanted to experience that. So, I had this bone marrow aspirate done, there's nothing there. Darren's getting very anxious, they're upping the morphine. I'm his mother, I'm supposed to give him his last dying wish if I can't do anything else. So I saw this cannabis tincture that I'd made previously when Bedrocan had not been an option. I made him a tincture myself. I thought cannabis can't be hard to get hold of, I'll just make something. But it wasn't strong enough in the pen, it hadn't done anything. But now I was looking at it in a different light and I thought to myself, well, cannabis chills you out, right? So if I can take the morphine away and the fentanyl away and the anti-sickness and these things away, maybe I can swap it for cannabis. We'll try. So I took a 5ml syringe and I placed it under his tongue. And within half an hour, his entire demeanour just changed, it dropped. I literally, physically saw him from top to bottom relax into his bed. And so already to me, that was a miracle. That was the death that he wanted. It was the death that we all deserved as a family to watch after 4.5 years of this. And so already to me, it was miraculous. 5 days later, the bandage came off his finger. And the doctors panicked because this is impossible. This is impossible without a functioning bone marrow. Now they told me 5 days previously there was nothing in there and the only thing I was giving him now was cannabis. There was nothing else at all. In fact, he was highly addicted to a drug called cyclazine, which is actually an antiemetic. But Darren had it administered to him in such a high rate that he was really euphoric by it and he was addicted to it for around about 9 months. And when I first gave him the cannabis and the nurse came to the door with the cyclazine, I shit myself. I'm not going to lie, I thought, oh my God, I've overdosed him, what have I done? And it didn't matter because he turned around to the nurse and said, take it away, I don't want it. And I looked at her and she looked at me and I was like, take it before he changes his mind. And he never had a drug again. He never had morphine again, fentanyl again, lorazepam again. He never had the anti-sickness again. That was it was done. So immediately, cannabis is an exit drug. It's not a gateway drug, it's an exit drug. It took him off all those things. And then this happened. His bandage came off his fingers. The doctors saw this and started panicking and telling me he wasn't dying anymore. And I said, hang on a second, hang on. You know, you told me 5 days ago there's nothing in his bone marrow, we need to do a blood test. Okay, go on then, do a blood test. But if it's not in his bone marrow, it's not in his blood. And they came back. And 5 days previously, his neutrophil count, neutrophils are part of the white blood cells that fight infection the most. His neutrophil count was 0.005. After 5 days of nothing but cannabis, it was 0.25. That's very small, but it's there. And it was enough for them to shred the do not resuscitate forms. It was enough for them to start talking to the hospital and saying, this kid's not dying. They called it a miracle. They called it a miracle. I didn't, I knew. But I couldn't say anything because of social services. I couldn't open my mouth. Not only would they have taken my son, they would have taken his younger brother, and the worst thing would have happened with it, he would have taken the cannabis away, which is now clearly the only thing working for him. So I had to keep my mouth shut. It's a miracle. But unfortunately, things got worse. And because Darren, and I'm really sorry Darren, this is the first picture, nobody's ever seen this picture before, but it's something that's so poignant to me. Because cancer's one thing, but when your child is refusing to eat because they want to die, because being told the promise that you're going to die, and then you don't die, but then the doctors are saying to you, could drop down dead next week, we don't know. We have no idea, we've never seen this before. So Darren went on a mission to starve himself to death because he didn't want to live anymore not knowing what was going to happen to him. And there was nothing I could seemingly do. So Darren, unfortunately, you can kind of tell by his elbow there how skinny he is as well. He got down to 24 kilos. And for 6 months, I begged him and begged him and begged him to eat, but nothing. Until eventually the hospital said to me, look, we're going to sedate him, we're going to section him, and we're going to force feed him. And I said, look, can you not just give him some mental health care? This is really, how can you expect a child of 14 years old to go through that and not have some semblance of distress? And they said he didn't qualify for any mental health care in this country. So it was left to me to try and find a way to get him to eat. Now, thankfully, a friend of ours had a villa in Spain, and they said, come over to Spain. So we went to Spain, and there we met another quite prevalent cannabis activist who gave us 1 mil of the RSO, FECO, whatever you want to call it. And he said to me, look, just put a tiny bit on, I don't know, a crisp, a cracker, something, get him to eat something. And so the following morning I did, a tiny little bit. And of course I had no qualms giving him some black oil that some strange guy had given me, because I've seen him off his face on ketamine and pethidine and fentanyl and morphine and opioids and sleeping. I've seen him on every pharmaceutical drug going. And cannabis had already saved his life once, but I didn't think actually about continuing to give him larger doses to try and get him to eat. It just wasn't, the cannabis wasn't making him eat at that point. But this concentrated stuff, I was up in the kitchen and I was just prepping some lunch, and I kind of shouted down, I'm making some lunch, does anybody want anything? And I expected the usual grunt that I'd had for the last 6 months. And Darren shouted up, make me loads, I'm starving. And got me right in the feels. And so I did, I made him some lunch. And his food of choice was pistachio nuts, and he ate for 12 hours that day. 12 hours of most beautiful sound you'd ever hear. And the next day, 12 hours, 12 hours, 12 hours. To the point where he was just non-stop eating. We were taking him down to the restaurant, didn't know what was going on. We were taking him down to the restaurant, and he was very skinny and very pale. He's very high there in this one. And the restaurant were looking at him and looking at me going, you sure he's going to eat all this? I'm like, yeah, he'll eat all this, fine. And he was monstering it away, and it was amazing. And we brought him back to England after 2 weeks in Spain, and the consultant sat me down, took Darren to one side and said, my God, his mental health has improved by 300%. And I said, I know. And she said, but he doesn't want to die anymore. And I said, I know. And she said, he's put on 4 kilos. I went, I know. And she said, my God, the holiday did him worlds of good. Yes, it was the holiday. And I'm sticking to that story. Until a couple of years later, where I felt strong enough that I was able to come out with the story, because every single day since June 2014, Darren has taken 150 milligrams of a whole plant extract, including THC and CBD in balanced ratios, and the recovery has been absolutely incredible. So everything that should be wrong with him is not wrong with him. So the hand that he should never feel again. 2 weeks after we came back from Spain, he started to tell me about his hand was hurting. And your hand can't hurt, you have no nerves. They've cauterized the nerves. There's no way you can feel your hand. I'm telling you my hand's hurting. I've since learned it's called neurogenesis, where actual THC specifically can cause neural pathways to regrow around damaged areas. So we see people with strokes recover completely after time. And the same was happening to his hand. Now he has full range of movement in his hands. It's only really the fingertips he can't feel, and he's an amazing chef, so it's not done him too bad. And I've been on TV, I've written a book, and we have made Darren go into speaking arrangements himself. He's now becoming a man of his own, and our message really, more than anything, is that just because they tell you there's nothing more they can do, that doesn't mean there's nothing more that you can do. And so, since then, I have been come to by many people who found themselves in the same situation that I was in. And I had a moral obligation, I felt, to continue the work and to help those that came to me. Because if the person that I'd gone to initially had turned around and said no, I don't even want to think about where I would be. So I now have a moral obligation and a duty that when people come to me, I source them the best oils that I can find, I can make, I get it tested, everything. That I work very closely with my friends in the front, and we now support hundreds of people every month that come to us because I've spread my story, and we help them get access to the very thing that I know works, because I've seen it, not just with him, I've seen it hundreds and hundreds of times since. And so this was my talk. It's a lot shorter than I usually do it, so I think the pictures has really helped me. But I guess what I really want to stress is that we can all do something. It doesn't just have to be someone like me or someone like JJ or somebody like the other people that are helping. We can all help, and the way that we do that is to stop the stigma and to grow our own and help our neighbours around us and to teach people to grow.
Come on.
And for the we need to take the power back, right? Because they're not going to give it to us. They're not going to allow us to have cannabis in the way that we want it and we need it. They sure as hell aren't going to give me what I need to give him every single day to keep him well and recovered. I want to talk a bit more about his recovery actually, because there's other things that was supposed to be wrong with him by now. He had what's called avascular necrosis in his right femur, which is basically over steroid use. Caused the blood flow not to get to the larger bones, because obviously he was on a huge amount of steroids from age 10 to 14. And they told me that he'd need a knee replacement if he were to survive, because avascular necrosis is irreparable. Necrotic bone is irreparable. Devin went in for an MRI scan about a year ago, and I was called into the doctor who said, Mrs. Blackwell, I believe you're under the impression that Devin had avascular necrosis. And I said, no, I'm not under the impression, I have the scans, would you like to see them? And he said, well, you know, I don't see this in any of my other patients. And I said, none of your other patients are taking cannabis oil. And he said to me, I knew you would say that word. And I said, no, I'm going to keep saying it until you listen, because he had 60 patients outside, and if it worked for him, it would work for them. And as doctors, we need to get them to start looking at this, and doctors need to start asking more and more and insisting that they're going to be prescribing this because they know that it works and they know that it's the best thing for the patient. This isn't about corporations. This isn't about making money for people who don't care about the plant. This is about making sure the people get what they need when they need it. And they need it right at the beginning of a cancer diagnosis. Any diagnosis of any illness, that's when they need cannabis, not at the end. I'm tired of seeing people come to me when they've got 3 weeks to live. It's by and large too late by then. But what we can offer in palliative care, because I saw it myself with my son, that for palliative care, cannabis, there's nothing better. It gives people a death that they deserve, one with dignity, one where they can be awake and alive and with their family until the last minute. I've had people come to me and say, do you know, I reached out to my brother who I haven't spoken to for 20 years because cannabis has done something to my mind. And it's building bridges between people. It's the spiritual element that we see most of, and it's the spiritual element that helps most really in palliative care. But to die a death of dignity with no pain, we all deserve that, and cannabis is, I can't, it is, there's nothing better than cannabis for anything. Cannabis can sort out everything, everything. So before I throw it out to questions, because I would love some questions, please. I know that I've missed an awful lot. How long have I got left, Anush? Oh, no, brilliant. Usually I talk for hours and hours, but I think the pictures have really helped me. But I really want some questions back. Anything you want to ask me, anything that you think I've missed. But before I do that, I would like to introduce my son, Darren Blackwell. I'm going to ask him to stand up.
Can I have a look at your hand, Darren?
Because without him and without the journey and without cancer and all of that, I wouldn't be doing what I'm doing now. I wouldn't even know. I wouldn't know about cannabis and its miraculous properties, and I wouldn't have been able to help all the people I have done since him. So he is really the reason why I'm here. And I just carry on the torch for all the people that have stood behind us and before us, you know, all the pioneers in America and everywhere else, all the people that have been fighting for this plant for such a long time. And what I don't want to see is, I don't want to see these people who have worked their asses off with the blood, sweat and tears of the grassroots movement to have some corporations come in and say, thanks for your 15, 30 years of work, we'll have that. No, that's not going to, I'm going to try and stop that anyway. I can't promise I will, but not on my watch. So does anyone have any questions? No, that's good, I'll go, thank you. That's avascular necrosis, was his knees, yeah, so... Because, yeah, give it to Phil, because they go on, Phil, don't hold the mic for like half an hour again though, right? Okay, come on, put a timer on him.
At the university, I can't remember the year, but they found out that cannabis regulates bone growth, density and development. Cannabis prevents osteoporosis in older people if you give them than cannabis. If you give younger people cannabis, it can cause osteoporosis in younger people. So when I had my arms chopped in half and plated back together, cannabis was my answer because it regulated the bone growth density of my healing. So when I was in Parliament, you mentioned his knees never healing. It's like, boom, Edinburgh University. Cannabis regulates bone growth density without eating.
Thank you.
Very good to acknowledge that.
And the evidence is there. This is the thing. The evidence is there. And I go into the doctors with him every time. They hate me now, actually. His doctor won't see me. Because I sit there and I go, explain this. I've slapped his hand on the desk and gone, come on, you told me this is irreparable. How does this work? I don't know. I'll tell you. I'll tell you. It's called neurogenesis. I slapped my book on the table and I said, you need to read this. And the doctors don't want to know. And it's frustrating because, you know, Darren, unfortunately for him, is that he shows cannabis as a preventative because he still takes it now because he has his own bone marrow back. The bone marrow that harboured the 2 cancers, that's what is inside his body now. I'm not going to risk waiting for that to come back to find out that cannabis was keeping it away. The recovery now that he's still going through, it's still recovering him. He's repairing from things that he should never have repaired from. He's now going to what they call... what's it called, where they do delayed onset effects of chemotherapy. So it's the delayed onset. So 6 to 10 years he should have cataracts, he should have heart problems, he should have liver failure, he should have all these things wrong with him. They're looking at him, they're testing him, and he's in better condition than he was pre-transplant. And they're scratching their heads. And I'm not, I'm saying cannabis, and they're putting their fingers in their ears. Frustrating.
Very frustrating, very frustrating. Has anyone else got any questions at all? I did see some other hands.
God, all the way back there.
Hello. What advice would you give to other people if they're in a similar position you found yourself in?
So initially, or what I'd love to say to people is don't wait until you're ill. Everybody needs cannabis now. We've all got an endocannabinoid system, so start feeding it. Don't wait until you're sick. Prevention is far better than cure, right? But we don't live in a world like that, and at the moment we are finding obviously people coming. We're finding people coming a lot earlier than too late now. A lot of people are, I've just been diagnosed. Brilliant, come, I want you because fantastic. When they come with very few weeks left to live, it's very difficult. So I would advise, as soon as you find yourself with a serious diagnosis, seriously look at your diet. We are what we eat. And that's not a myth, we are what we eat. You put poison and plastics and horrible nasty things in, don't expect to get anything good out. Okay, so that's the first thing. Sort your diet out and then add cannabis, because cannabis can only do so much. And if you're putting McDonald's away and you're having cannabis, don't complain when the cannabis doesn't work. It's not cannabis's fault that you can't, keep yourself healthy. So we have to give cannabis everything we possibly can to help it help us. So it starts with our diet, it starts with that. Look after yourself. That's the best advice I can give you, is really look after yourself and try and prevent anything. Hello.
Have you had anybody approach you about Marfan's syndrome?
Sorry, say that again?
Marfan's, do you know Marfan's syndrome?
I haven't heard that one.
It's a degenerative disease that affects the connective tissue.
Okay.
And we have a couple of people in our family that are suffering from this, and I wondered if you'd had anybody.
Okay, I haven't,
No.
personally. JJ might have done, but what I would say is if they're mammals, they have an endocannabinoid system, so it will work. How much it will work and how well it will work will determine lots of other variables, because as I say, cannabis can help, but if you've had 6 years of chemotherapy and you're all, we've got a lot of work to do. But for someone in your position with, family members like that, I would definitely say try it. What have you got to lose?
Thank you.
No worries. And if you want to come and talk to me after, in fact, JJ's going to come around and talk to you now.
Cool. I think we've got time for one more, if anyone...
Oh,
Yeah.
Go on.
One last one?
Got a live one.
So we were talking earlier about, speaking your truth and spreading the message, but a lot of people are quite scared to do that with repercussions of your career and things, especially when someone actually next to me works in a medical setting as well, around doctors and things. So what would your advice be as to, be true to yourself, but also,
Yeah, so you
to
had...
maintain a career, but would you say be vocal about it and kind of do that? And if there are repercussions, then that maybe wasn't a good fit for you.
In that, because obviously we do have to consider it. I'm very lucky. I at the point where I go canvassing, I had nothing to lose, and I still really have nothing to lose. There's nothing they can do to me that's worse than what I've already been through. So, but for people who have jobs and things like that, all I say is the advice I give to anyone is plant a seed. You won't lose a job by planting a seed. Plant a seed in their minds and let them go their own way, because they'll always remember you for planting that seed. And
seed grows.
yeah, plant. Just tell anybody that you can. Just go, did you know about this? Oh, put this article here and oh, this here, and plant that seed.
Cool. Thank you, Callie. I think we'll round it up now, but this is a packed house, by the way. Yeah. Fantastic. Really great talk. Thank you.
Thank you very much. Thank you.
And we're done.